Good afternoon. Oh, it's still morning, sorry. So, good morning, colleagues and friends. Thank you, John, for inviting the World Hepatitis Alliance. And I'm here with Carrie, the CEO of the Alliance. And we have Suwang, our past president, and BC Bright, and seeing a lot of new and old faces. So, thank you so much for having us. I don't have a slide, but I just speak from my heart and my head. So the World Hepatitis Alliance, as you know, it's an international organization that builds advocacy, awareness, and bringing the face behind all the statistics on hepatitis. And when you talk about the 1.1 million deaths of hepatitis, these are human beings, and these are either men, women, uncles, fathers, brothers of people around the world. So I would say that I'm also living with hepatitis B, and I'm also one of the face behind the 250 million people that have hepatitis. Now, I was asked to talk about people-centered care. So while the global community advocates and talks about eliminating viral hepatitis, it's very important for national programs and WHO and all other partners to also consider the social, economy, psychosocial impact of the disease among affected populations. So while we're treating the disease, while we're treating and eliminating the virus, we should understand how it impacts on the lives of people living with hepatitis. And this also should be a priority in programs and interventions, and not just the medical, but the social, psychoeconomic, the mental well-being of patients is a crucial, important part of elimination of hepatitis. I tell people that it's traumatic to live with a disease that you know could cause you liver cancer. I had to start treatment for myself, regardless of the evidence by the clinical community of waiting for my viral load to go up. No. So the mental, social, psychosocial impact is also very crucial to consider in national programs and while implementing activities. Stigma and discrimination affects us to live meaningful and happy lives and to pursue goals and opportunities in life. People living with hepatitis are denied opportunities for visas, denied opportunities for travels, denied opportunities for jobs because they live with a virus that is treatable and that is curable. So these are also very important parts that the global community needs to consider in driving elimination of hepatitis. So while we're eliminating the virus, we should look at the impact it has on the millions of people all over the world. I receive a lot of emails, even as Alliance of Hep Foundation, about people that are denied, sent out of jobs, sacked from jobs because they're living with hepatitis. And all of this is driven by lack of understanding or misinformation, myths and misconceptions that drive this stigma and discrimination against people living with hepatitis. So while you eliminate the virus, it is important to treat the patient with dignity and respect. People living with hepatitis should be treated with the dignity and respect they deserve. They should not be denied visas or job opportunities or social interactions because of the virus that is living in them. So people-centered care, as it is enshrined in the GHSS, promotes the rights of people living with hepatitis and hepatitis B or C as equal partners in co-creating care for themselves. So it's a big challenge that WHO sets the global framework, but it's really concerning that national programs seldom include affected populations and people with hepatitis in driving and co-creating the care for themselves. So people-centered care goes beyond just inviting people with affected populations, but giving them the space at the table where decisions are made. So it takes away paternalism, takes away the concept of I'm doing you a favor, but we need to be on that space where decisions are made. So it is a patient's inalienable right to be a co-partner in healthcare services. So I'm saying this because so many national programs have, the beautiful policy documents, but translating it into action, especially at the country level and community level, is always a big challenge, where patients are regarded only as beneficiaries, but not as co-partners in creating the care for themselves. So I round up by saying that the global community should put the face, to understand that behind these statistics of these numbers are people with aspirations, goals, dreams of living happy lives, but these are denied them. One, because they have no access to the care treatment, they have no access to this curative solution. Harvey Alter, the great, the Nobel laureate, discovered this. But however, we have a solution, but people still lack access to this, either because of lack of commitment or no commitment, or because of the discriminatory policies that affects people who live in hepatitis in having right access to this treatment and solutions that the world is celebrating. Thank you so much for having us, and do have a great day.